Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. First up, UnitedHealth is restoring Change Healthcare services by mid-March. Change Healthcare expects key system functionalities to be restored mid-March following the cybersecurity incident February 21st, obstructing healthcare connectivity nationwide. Starting March 7th, claim submissions and payment transmission should be online, and the payment platform available starting March 15th. The Medical Claims Network expects to begin connectivity establishment March 18th. Optum has launched a temporary funding assistance program on March 1st to supply short-term cash flow for providers who receive payments processed by Change Healthcare. Prior authorizations were temporarily suspended until March 31st for most Medicare Advantage plans, dual special needs plans, Part B therapies, durable medical equipment, and Part D drug exceptions review processes. UnitedHealth is working tirelessly to ensure providers can care for residents and continue daily operations. Next up, the House Committee approves measure to stop imposing new red tape on nursing homes. The House of Representatives Ways and Means Committee voted Wednesday to pass a bill blocking CMS's proposed minimum staffing mandate for nursing homes, citing that the mandate sets them up to fail. 190,000 nursing home employees have left the industry since the pandemic, and if implemented, 94% of nursing homes will not be compliant. 45% of SNF participants in AHCA's recent report said that they're operating in the red or barely breaking even. Despite providers' best efforts, staffing shortages are a real concern. The rule would only make things worse for residents and staff who support them. The nation's two largest LTC provider associations and more than 1,100 co-signers expressed support to block the mandate, citing concerns of increased labor costs with little to no additional funding and a one-size-fits-all approach that could disproportionately affect rural facilities. Argentum, Leading Age, and industry advocacy organizations expressed concerns that the mandate would affect providers on the LTC continuum because providers compete with nursing homes for some of the same workers. Next up, inside successfully navigating pain points of Medicare Advantage plans. The growing prevalence of Medicare Advantage plans in many skilled nursing markets has been a source of mounting challenges for operators, but leveraging data analytics, fostering inter-provider collaboration, and prioritizing staff education can help. There have been concerns of a significant gap in reimbursement between Medicare Advantage and traditional Medicare plans, citing a 40% reduction in payment. Formation of an appeals consortium comprised of 7,000 nursing homes will collectively address managed care contract negotiation and appeals process. It includes access to hotlines for assistance and training, utilization of data-driven insights to highlight quality outcomes, and negotiate competitive reimbursement rates. AI and data analytics optimize operational efficiencies and decision-making processes. They're useful to identify trends, streamline workflows to improve outcomes, and 5-star rating. Feels like a risk. Nursing home operators appear to reduce wage increases compared to 2023. Labor costs continue to be the top of mind for nursing home operators as workforce shortage persists and anticipated finalization of federal minimum staffing rule. Operators reported the average wage increases for employees of 4.43% in 2023, dropping to 3.64% thus far for 2024, according to a survey conducted in February 2024. Nurse wage increases went beyond 3% as operators have tried to stay competitive, and others received 12% wage adjustment increases. Operators are taking time to conduct compensation studies through outside firms and making adjustments. Some complained of turnover, with employees leaving shortly after receiving sign-on bonuses. 42.7% of respondents said there wasn't any attendance bonuses at all. Others have added Martin Luther King Day and Juneteenth holidays, offered gift cards for not calling off days prior to holidays or the day after, and contributing to 401k and pensions. Thanks for joining me for News This Week in Nursing Home. To get more Qsource news and info, visit qsource.org to view podcasts, Sign up for the newsletter and remember, for all of your QI needs, call the Q.